Today we will be discussing report writing in gynecological ultrasound and obstetrical ultrasound. First is the report writing in gynae. The first part of your report is same as that of abdomen, that is of identification. Identification of the patient means the name, age if required, and gender usually we don't need in gynecological or obstetrical ultrasound. So we write the name. A full name with last name is better because, for instance, if somebody is having a name like Kausar or Parveen, and if you get 10 patients a day, you can get 2 patients with same first name. So you can write the name of the patient, full name, or the name of the patient with the name of father or husband. The sonologist, radiologist, or gynecologist, whoever is scanning, their identification is also important. As we discussed earlier, your name, your reputation is important. So if your letterhead is showing your qualification with your name, that will be enough. But if you have multiple people who are scanning at same center, you need this column to be filled by the person who is scanning that specific patient. The time and date of scanning is usually on your printout, but it's better to write on the report also. It will be better if you write machine and probe used. This is usually not mentioned in many reports, but it's an additional point. Sometimes the type of machine matters a lot. It can give you edge or it can save your neck. Uterus, first thing, we know the anatomy that we have got the uterus, which is having fundus, the body of the uterus, cervix. At the body of uterus and cervix is the internal os. Yeah. And then external os is at the union of vagina and cervix. So size is important. In an adult woman, the normal size is from 6 in some books, 5.5 centimeters to 10 centimeters. Any uterus above 10 centimeters is usually labeled as enlarged uterus. Any uterus which is less than 5.5 centimeters from the external os to the fundus is called smaller uterus or infantile uterus. We are talking about non-gravid uterus. Obviously, in second, third trimester, a gravid uterus uterine size will be enlarged.